Hello everyone, welcome to my channel. Today we are diving into one of the most essential skills of any healthcare professional, that is patient counseling. So if you are a PharmD student or a pharmacy intern or even a curious learner, this video will help you understand what patient counseling is and why it is important and how to do it effectively. Okay, so let's begin with the question, what is patient counseling? So, actually, patient counseling is a process where pharmacists or healthcare professionals they provide vital information, advice, and support to patients uh, how to use their medication safely and effectively. Also, it is not just handling over a prescription to a patient and telling that our work has been completed. It's about to ensure that the patient will understand the treatment and they show medical adherence to the medications to the treatment. Okay, and they should know how to handle the side effects and missed doses. So the patient counseling, it involves communication, empathy, and clinical knowledge. So coming to the objectives of the patient counseling, we should ensure medication adherence. As healthcare professionals, we should ensure that the patient shows medication adherence. So, showing medication adherence is the most important step to to get cure of their disease or of their symptoms. Okay. The secondly, we should try to minimize the medication errors. Okay, we should minimize the medication errors. If a patient got two or three drugs to take, and then the patient should not be confused between the drugs. Okay, we should educate them about the drugs they are taking morning, afternoon, or at night. Okay, or they are taking the medications before their meal or they are taking their medications after the meal. We should educate the patient about the medication adherence and to minimize the medication errors. As the patient follows the medication adherence, then automatically they will improve the therapeutic outcomes. The therapeutic outcomes will be improved. So we should empower the patients to self manage the side effects or the common side effects that a particular drug can cause. Lastly, we should identify and prevent drug interactions or side effects. It is our duty to ensure medication adherence, to minimize medication errors, improve therapeutic outcomes, empower patients to self manage the common side effects, and identify, prevent drug interactions or side effects. So remember, our goal is to educate the patient, not just to inform the patient about the drugs. We should educate the patient about the drug dose, route of administration, and the timings when that particular patient should take, and everything about the drug the patient should know. So that we should educate the patient, not just informing the patient about the drugs. Okay. So the steps in effective counseling are: firstly, we should establish a rapport with the patient. For that, we should just greet the patient with a smile and then create a comfortable environment for the patient to talk with you freely, to ask you questions freely, to talk with you about the disease or about the treatment. Secondly, and assess understanding. So, for that, you should ask open ended questions. You should ask open ended questions to the patients like, what do you know about this medication? Right. So, next, you should provide clear instructions to the patient, right? You should tell the patient about the dose, about the route of administration, about the timing of the timing at which the patient should take. You should tell them about the drug which should be taken before meal and which should be taken after the meal. Okay, you should tell the duration and the name of the drug, etc. Right? So you should also discuss about the side effects with the patient. But in this thing, you should discuss about the common side effects a drug can cause, and we should not alarm them. Okay, we should not make them panic about the side effects. We should tell them uh, in softly, and we should also tell them how to manage the side effects, and we should not alarm them, because when you alarm the patient about the side effects, there is a cause that they may stop using that particular drug. Okay, so we should encourage questions like, we should ask the patient about the queries they have, the questions they have, like as you have a good rapport with the patient, if you build a good rapport, then they will ask the questions to you. If they have any doubts, let them speak, let them ask you, right? After that, you should check the understanding of the patient. For that, the best way is to teach back method. And you should just tell, can you tell me how you will take this medication? Then the patient will tell how he will take that medication. Okay. Finally, follow up and refer. If needed, arrange a follow up and refer to a physician. The important thing here, the in effective counseling, is always use simple language and adapt based on the patient's age, literacy, and culture of the patient, right? Always use simple language that the patient can understand freely, easily. Next, common mistakes that ought to be avoided in patient counseling or talking too fast or using medical terms. As a patient will not know about the medical terms, you should not use the medical terms. T- uh, Talking too fastly can make them threatened, and they may not ask the doubts they have. Okay, so we should avoid talking too fast or using medical terms. Not making eye contact shows your disinterest in telling about them, right? So they may not listen. After that, ignoring the cultural or language barriers. It is always important to talk to a patient in the language the patient knows, not in the language you know. Okay? So, assuming that the patient already knows everything, it is a big mistake, right? The patient will not know about the medication. That is why he is patient and he came to you, right? You should educate the patient about them. Rushing through the process of patient counseling can make the patient medication non-adherent. Okay, that may lead to um, serious side effects, right? So thanks for watching. So always remember that your words can build trust or create confusion, so choose them wisely. So that's all for this video. Until next time, stay curious, stay passionate. Bye. Thank you.